Acetylsalicylic acid 80 mg. Comprehensive information. Acetylsalicylic acid 80 mg. 1. Drug name. Acetylsalicylic acid 80 mg. 2. Composition. This medication contains 80 mg of acetylsalicylic acid. 3. Uses. Acetylsalicylic acid is a nonsteroidal anti-inflammatory drug NSAID that works to relieve pain, reduce fever, and decrease inflammation. It is used to treat symptoms of headaches, toothaches, the common cold, muscle and joint pain, rheumatoid arthritis. 3. Uses osteoarthritis, bursitis. 4. Contraindications. Allergy. Hypersensitivity to acetylsalicylic acid components. If you have a history of allergic reactions to acetylsalicylic acid or other NSAIDs, you should not use this medication. 4. Contraindications. Bleeding. Acetylsalicylic acid can increase the risk of bleeding. If you have a bleeding disorder or a history of bleeding, you should not use this medication. 4. Contraindications. Low platelet count. Acetylsalicylic acid can lower the number of platelets in your blood, which can increase the risk of bleeding. If you have a low platelet count, you should not use this medication. 4. Contraindications. Peptic ulcer disease. Acetylsalicylic acid can worsen peptic ulcer disease. If you have peptic ulcer disease or a history of peptic ulcer disease, you should not use this medication. 4. Contraindications. Heart disease. This medication can increase the risk of heart attacks and strokes in people with heart disease. If you have heart disease, you should talk to your doctor before taking acetylsalicylic acid. 4. Contraindications. Liver disease. Acetylsalicylic acid can be harmful to the liver. If you have liver disease, you should talk to your doctor before taking this medication. 4. Contraindications. Kidney disease. Acetylsalicylic acid can increase the risk of kidney problems. If you have kidney disease, you should talk to your doctor before taking this medication. 4. Contraindications. Asthma. Acetylsalicylic acid can trigger asthma in some people. If you have asthma, you should talk to your doctor before taking this medication. 5. Side effects. When using acetylsalicylic acid, you may experience some side effects, including nausea, indigestion, fatigue, rash, muscle weakness. 5. Side effects. Shortness of breath, liver toxicity, low platelet count, bleeding. 6. Dosage and administration. Dosage. The dosage of acetylsalicylic acid will vary depending on your condition. You should follow the instructions of your doctor or pharmacist. Administration. The medication is taken orally with water. You can take the medication before or after meals. 7. Precautions. Pregnancy. Acetylsalicylic acid can be harmful to the fetus. If you are pregnant or planning to become pregnant, you should talk to your doctor before taking this medication. 7. Precautions. Breastfeeding. Acetylsalicylic acid can pass into breast milk. If you are breastfeeding, you should talk to your doctor before taking this medication. 7. Precautions. Driving and operating machinery. Acetylsalicylic acid can cause dizziness, drowsiness, or fatigue. If you experience these symptoms, you should not drive or operate machinery. 7. Precautions. Drug interactions. Acetylsalicylic acid can interact with some other medications. You should tell your doctor or pharmacist about all the medications you are taking, including prescription drugs, over-the-counter drugs, vitamins, and herbal supplements. 8. Storage. Store the medication at room temperature, in a dry, cool place, away from direct sunlight. Keep the medication out of the reach of children. 9. Important notes. The information provided here is for general knowledge and should not replace the advice of a doctor or pharmacist. Always read the medication label and instructions carefully before using this medication. 9. Important notes. If you have any questions about acetylsalicylic acid 80 mg, consult your doctor or pharmacist for advice.